Hi, everyone, and welcome to the last session of the Governor's Office of Disability Affairs Conference for the second day. It is emergency preparedness. Are we over it yet? We cannot afford to be over it. And our presenters are Amy Dawson, who is a CEM, and Amy Dawson, CEM, is a Community Preparedness Branch Manager at the Governor's Office of Homeland Security and Emergency Preparedness in Louisiana. All of her bio, as well as all of the bios of all the presenters for the conference, are in the link to bios, which is in the conference schedule. Cheri Crain has worked for the state of Louisiana for over 20 years, and she is now works at the Governor's Office of Elderly Affairs, and she is a compliance and planning program manager too, and oversees the responsibility of disaster management. Dr. Crystal Henderson is currently FEMA's Regional Disability Integration Advisor for the state of Louisiana. And Jessica Michot is the founder and director of Trach Mommas of Louisiana, which has done a lot of work in regards to disaster response for people with complex medical needs. And I will also be speaking in this panel, and I am Bambi Polotzola, and I am the Director of the Governor's Office of Disability Affairs. So thank you guys all for doing this presentation. I'm gonna go ahead and share the PowerPoint now. I have that duty. Let's see if I can get this right. Okay, can you all see the cover page of the PowerPoint?
I can see it, Bambi. This is Amy.
Okay, Amy, well, you can go ahead and kick it off.
Well, good afternoon, everybody who's made it this far to the afternoon on emergency preparedness. This is living in South Louisiana or anywhere in Louisiana is really an important topic, as we've all can attest to over the past year. So we've entitled this Emergency Preparedness, Are We Over It Yet? And at this point, I'm going to kick it over to my colleague, Jessica, to talk about other, other issues and make some parallels between emergency management and how you have to really be informed and stay informed and, make sure that we can't be over it yet. Jessica?
Thanks, Amy. So are we over it yet? That has been a statement. I'm so over it. I'm so over it. That's been something we've heard over and over again for the last year and a half. I'm so over COVID. I'm so over these weather events. I'm so over everything. I think we can all attest that we have reached our maximum capacity for stress over the last year and a half at various times. So I just wanted to tell a little story. I have two sons who had tracheostomies, and G-tubes were on oxygen and ventilators. And something our doctors taught us early on was about alarm fatigue. So what is alarm fatigue? That is something that is well known in the nursing setting. And it's kind of when nurses become desensitized to alarms and they don't recognize the important alarms. So they hear all these bells and whistles in the hospital settings, and then they stop paying attention to them, frankly. So that's something doctors taught us early on. Hey, you're gonna get alarm fatigue. You have to pay attention. So that was something that was ingrained. Well, it happens in caregiver settings. So my son was probably 6, but maybe 7. He had been home about 5 or 6 years. And my son alarmed constantly, like over 10, 20 times a night, from his ventilator, from his concentrator, from his pulse ox machine. Sorry, he just alarmed a lot. And it was important to acknowledge that. Well, it was one period of just lack of nursing, just not good sleep for me. And his alarm started going off. And it was one of those periods too, where, you know, you just fall asleep, but you're not really asleep, and you're kind of groggy. And his alarm started going off. And I remember thinking, do I have to get up? Like, it's just another false alarm. And I got up. And luckily I got up, because at that point, his blood oxygen saturation was in the 80s, the lower 80s, and his ventilator was malfunctioning. So the big thing with alarm fatigue is a lot of lives are lost, because a lot of people miss those alarms. And that night, we very well could have lost him. And I tell this story in the disaster setting, and you're probably thinking, why is she telling this? This is on emergency preparedness. Because people are saying, are we over it? We're so over this. And it's easy to get in that mindset. But we don't have the luxury. Our families don't have that luxury. It's not, I have a newborn baby. I can stop at Walmart and buy his formula when we evacuate, and it'll be fine. I couldn't do that with my sons with tracheostomies. I couldn't buy their supplies at Walmart. So it takes a little bit more preparation for our families, and we don't have the luxury that other families have to not be prepared for every event. So it's important to not have disaster fatigue, just as important to not have alarm fatigue. So I just wanted to kick it off and tell that little story, and hope to kind of drive that point home that we can't afford to be over it yet. And I'm going to send it back to Amy.
Jessica, thank you so much for sharing your story about your amazing sons. Gabe was such an amazing little boy, and we've learned so much through your advocacy and through so much from him, that this really hits home for us. And, you know, just like she said, you can't be fatigued on alarms. Well, you can't be fatigued in disaster response. So we're going to do a little recap of where we've been last year. Emergency management really roles and responsibilities. FEMA, Dr. Henderson's going to do some FEMA myths, and we're going to talk a little bit about what you can do to be prepared. Next slide, Bambi. So this is a list of all of the federal declarations that we had last year. COVID pandemic was March of 2020. We activated for Tropical Storm Cristobal. That was June. Tropical Storms Laura and Marco. That was August. Sally was next in September. Hurricanes Delta and Zeta were both October of 2020 of last year. Then we were hit by severe storms in February. And then again, we were hit by another round of severe storms, tornadoes and flooding. And that was May of this year. So a lot of our families have been activated, or a lot of our families have evacuated or sheltered. Some people have lost homes from multiple disasters. So these were the number of federal declarations that we had last year. And so you can see just in the past year, how many times people and families had to respond and to pull out their emergency preparedness plan. Next slide. So just a bit about a hurricane season. Last year, we evacuated our EOC 7 times due to threats of tropical cyclones. Hurricane Cristobal, Hannah, Marco, Laura, Sally, Delta, Zeta. By the time we were finished, we thought we had pledged a sorority or a fraternity with each other. Last year, we experienced the most tropical cyclones, which was 5 to make landfall all in one season. That was Cristobal, Marco, Laura, Delta, and Zeta. It was the first time we've ever had 2 landfalls in October that late in the season. So I know we always talk about early on in the season, but you know, around October is kind of when we kind of catch our breaths, but we couldn't catch our breaths this year because we had 2 landfalls. Next slide. So we cannot afford to be over it. Like Jessica said, our families can't afford to be over it. Our citizens can't afford to be over it. We are still just as at risk. We are still, you know, as we ramp up and things ramp up for COVID, we thought we were over COVID. We are now seeing more and more people at our state isolation site. We are getting requests for more and more testing kits. I've never seen this amount of testing kits that come through our state system since before the vaccine. So we can't be over COVID either. And COVID brings a totally different nexus onto evacuation and sheltering. So next slide. So in emergency management in Louisiana, in 2006, we formed what we have all affectionately termed MDAC, the Louisiana Emergency Management Disability and Aging Coalition. And it formed as a result of the life safety issues that people face following Hurricanes Katrina in that 2005 season. Some of our membership include individuals, and those individuals are a lot of times people with disabilities. They are people who were key in their state agencies or representing agencies that support people with disabilities, and then they've retired. So we've had them stick around. There are various state agencies on MDAC. There's nonprofit organizations, and there's some for-profit businesses, such as some of the insurance companies that are a part of this Emergency Management Disability and Aging Coalition. This is the coalition that really supports and tries to guide and give resources and guidance to our local emergency managers. A lot of time emergency managers or retired military, they are retired fire chiefs or police chiefs, and really don't have an expertise in disability and disability awareness. So we're the team that formed that helps guide those emergency managers in disability and planning for, responding to, and helping the citizens recover in their jurisdictions. Next slide. So this is a bit about our mission statement. We feel MDAC is a group that's going to advocate for and to support emergency management efforts to serve all people in Louisiana, and particularly those people with disabilities and those who are aging. We believe that the needs and the safety of all people, particularly those with disabilities and who are aging, must be carefully considered and adequately addressed before, during, and after a disaster or emergency within the state. So this is a little bit about our mission and our value, and we provide that to emergency managers. We try to help them, guide them in their planning efforts, help them with their exercises. And then when we go into response, we try to bring them as much knowledge and resources as we can. Next slide. Bambi, are you there? Next slide. So this is a little bit about emergency management roles and responsibilities. If anybody is up late at night or you need some good reading to sleep, this is the law that defines how Louisiana conducts emergency management. So Louisiana Revised Statute Title 29, Chapter 6, it defines the roles and responsibilities of parish and state leaderships. It talks about the role of the governor. It is the basis of how we are structured in Louisiana for emergency management. Next slide. So Parish Office of Emergency Preparedness. Each parish, each one of the 64 parishes in Louisiana has an Office of Emergency Preparedness. Each parish office has a director, and that director in that office has a local emergency operations plan. Those directors are the first line of defense for an emergency. So a lot of times when we have emergencies or disasters, the local jurisdiction, the Office of Emergency Preparedness director will work with the parish president or the police jury president, and they will come up with if it's appropriate to call for an evacuation, if it's appropriate to open up a shelter. A lot of times we think big hurricanes, but a lot of local emergencies are done and handled at the local level. Like I said, each parish has a plan. Each parish has agencies that respond and work day to day in that local jurisdiction. I don't know if this is the slide I'm on, but
Amy, I apologize. It started to move forward without me moving it, so I'm not sure where we were at.
It's okay.
See, it starts to move forward by itself. So that somebody must have put something in this PowerPoint to make it go forward on itself.
Okay. That's okay. We can go on. Each local parish office of emergency preparedness, they have a special role. They are the ones who do alerts, and they are the ones who will notify their citizens if there is an emergency or disaster. That's not really something that the state does, or something that FEMA will do. The responsibility for alerting our citizens that there is an emergency really rests within the local jurisdiction. Next slide.
Amy, what slide are you on? I apologize.
It's okay. This one says the Louisiana Homeland Security and Disaster Act.
That's where you're at right now?
That's what I see. If you can advance it, that'd be great.
Okay. You talked about the parishes.
Yes, every parish has its jurisdiction, and every parish has their plans. So each office, like I said, there's local warning and alert systems. It is very, very important to know if your parish has a local warning system and know how to sign up. You can actually find lists on our website, the GOSEP website, or you can Google your local Office of Emergency Preparedness. A lot of them have websites where you can sign up for alerts and warnings. Some of our major jurisdictions, such as Baton Rouge, has Red Stick Ready. New Orleans has NOLA Ready. So you can go to those websites and go to their websites, call their offices, and ask them if there's a local warning system, and if you should sign up for that. Next slide. Some parishes also have local special needs registries. There's two thoughts out there on special needs registries, but if your parish has one, call them and sign up. And not just call and say, I want to put my name on a list. Ask them a few questions. Ask them, what does this mean for you? So do I have to register every year? Does it mean that somebody's going to call you in an emergency? Does it mean that somebody's just going to show up at your door with the bus to pick you up? Or do you have to call them in an emergency and request assistance? So make sure you, one, are familiar with your parish Office of Emergency Preparedness, and two, see if there's alerts or warnings that you can sign up for, and three, ask them if there's a local special needs registry, and if you need to put your name on it, register on that system, if that's something you choose to want to do. So next slide. So some of the laws in emergency management, parishes must use their own resources before coming to the state to ask for assistance. And once they've exhausted all of their resources, then they can request resources from local or other state partners. Next slide. So some of these questions are, how do I know if I need to evacuate? How do I know what shelters are open? What do I do if I need transportation? Pay attention to your local officials. The local officials will tell you if you need to evacuate. A lot of times during our last rounds of evacuations and shelters, we partner with 211. So you could either text 211 or you can call 211 and they would tell you which shelters were open for that particular event. Your Office of Emergency Preparedness will also have what they call parish pickup points. So if you don't have transportation, the parish has plans to provide that. So you might have to get to a local parish pickup point where coach buses, or we do have paratransits on contract, or we do have a few ambulances if that's the type of transportation you need. So make sure if you need evacuation assistance, ask them where that parish pickup point is And if you can't get there, call them up and say, look, I can't get to the parish pickup point. Someone might need to come and pick me up. So parishes in the states have plans to evacuate people out of our coastal areas to shelters during a hurricane that are usually up north in safer locations. Also on transportation, there's a small percentage of our coach buses that have mandatory lifts and can take power chairs. We have tried to contract for more. They are, as you guys already know, transportation assets are limited when it comes to people with disabilities or the aging. So it's not going to get any better in an emergency. So if you need to leave early, or even if the local official isn't calling for any type of evacuation, but you know that you're electrically dependent, call your local resources, whoever transports you to your doctor's office, whatever local, medical van, ask them if they can transport you to a shelter location somewhere. Make sure you keep in touch with all of your support services, because those people are still connected to us in our MDAC group, even during an emergency. So during an emergency, I know I've talked a lot about pay attention to your local emergency management officials, but also work with the groups that you're connected to every day that help provide services. They will be a good resource for you when you have to evacuate or shelter. And if you're one of those groups that actually support, you're one of those groups that support people, or you're participating today as a provider, if you need help, reach out to one of our MDAC partners during an emergency. We run daily stakeholder calls during an emergency to make sure that we know of any and all unmet needs out there. So I know that my contact information will be somewhere on this presentation, or Bambi have it on my bio. Reach out to us if you're one of those providers, or if you're a person with disabilities and you want to get some additional assistance on making a plan. Just reach out to me and we can figure out what's best for you. But continue to work with your locals and the people who support you every day in your everyday activities of living. So, next slide. All right, I'm going to turn it over to Ms. Cheri, who's going to talk a little bit about the Office of Elderly Affairs.
Thank you, Amy. So I'm just going to kind of go over a brief overview of what the Governor's Office of Elderly Affairs does. We are the state unit on aging for Louisiana. The core programs for which GOE has oversight is a wide range of in-home and community-based supports to basically help the aging citizens remain independent, active, and at their house. These programs serve as the foundation for the Aging Network's responsibility to bring together and coordinate a variety of services and activities for older adults. Next slide, please. So we put this in here to just kind of give you an idea of what our mission is, our philosophy, and our agency goal. I'm not going to read the whole thing, but basically our mission is to serve as the focal point for the development, implementation, and administration of public policy for the state of Louisiana to address the needs of the state's elderly citizens. Next slide, please. So some of the services that we provide, we target those older citizens who are more vulnerable and are in need. We provide services to individuals who are at least 60 years of age and are assessed to be the most needy. Our agency network consists of 64 councils on aging, one in each parish. These councils are the boots on the ground that provide those services to the elderly, in addition to the aging and disability resource centers that serve the aged and disabled population. Next slide, please. So some of those services that our councils on provide agency is meals, transportation, Senior RX program, our Aging and Disability Resource Centers program, State Ombudsman program, Elderly Protective Service program, and our Senior Employment program. If you need any more information or any details on any of these programs, please just reach out. My contact information will be coming up shortly. We can get you any information that you need on these services, and we can send you to the right person to talk to them to see if you qualify for these services. What we find is there's a lot of seniors that really don't know what kind of services we provide until they need them. We want to try and get out the word before you need those services, if at all possible. Next slide, please. GOEA participates in mass feeding, response, and recovery support functions during disasters, which also includes some of our state and federal councils, committees, and conferencing to accurately assess the needs and support services of citizens that are affected by disasters. So when we, as Amy mentioned, we have several committees that we're parts of, that we work with other, agencies to provide those mass feeding, provide those recovery support functions. So we have contact with a lot of other agencies to make sure that everybody is getting the services and the support that they need during a disaster. So the next slide, please, Bambi. So here's my contact information. It has my email address and my phone number. So if you need any more information on services that the Governor's Office of Elderly Affairs provides, please reach out and we can get you the information that you need. So that is the end of the brief overview of what the Governor's Office of Elderly Affairs provides. I'm going to now give it to Crystal Henderson with FEMA.
Thank you so much, Cheri. I think I'll wait for Bambi to catch up. I think Bambi's gonna go now.
Hi, everyone. Just want to share a little bit about what the Governor's Office of Disability Affairs role is in regards to emergency and disasters. And as you hear the other presenters today, I usually say my role is just listen to them because they are the experts. And and so I really appreciate the partnerships that we have with the presenters and with others, and that we have people who are so committed to ensuring that people with disabilities and who have access and functional needs their needs are being met in regards to emergencies and disasters. So what GODA role is we facilitate meetings and preparation during and after emergencies. We coordinate basically all the participants in the EMDAC effort, and we do community outreach and engagement in regards to emergency situations and making sure that we have all the stakeholders at the table. We create partnerships with community organizations, and then we're also able to communicate with our state and local governments, whether it be on individual needs or in regards to the community organizations that want to help or need some type of support in helping their communities. We also do assessments of needs in our sheltering environment and environments, I should say, which has been interesting doing I guess Governor Edwards' first term. Before COVID, we would go to large or mass sheltering and be able to interact with the people who needed shelters and were in those shelters, and try and identify what those needs are and then try and get them what they needed. Since COVID and last year with all of the weather events, people were in hotels, and so that just made it a little bit different in identifying the needs of those people who were being sheltered within hotels. But with our partnerships with, as I said, with all of our community agencies and with our state and local government, I feel that we've done a good job of being able to identify those needs and coordinate those needs, and to be a voice for people with disabilities who have access and functional needs. And this is my contact information. I think Dr. Henderson, it's your turn.
Thanks, Bambi. Good afternoon, everybody. My name is Dr. Crystal Henderson, and I have the pleasure of not only serving as a member of MDAC, but I am the Disability Integration Advisor for the state of Louisiana. And the first question I'm always asked is, what does that mean? What is disability integration in terms of FEMA? So in disability integration, we serve a dual role. We serve all of FEMA programming, but we also serve the community as well. So I'll kind of go through the importance of each. So within FEMA, we support all FEMA programming, whether it be individual assistance, public assistance, external affairs, Office of Equal Rights, Civil Rights, et cetera. So we advise all of FEMA programming on making sure that messaging is accessible and all FEMA programming is equitable and inclusive. We also provide technical assistance, and we also do a lot of training internally for the different programs within FEMA. In terms of the community with disability integration, we mainly, a large part of it is we work on building relationships with community partners, whether it be local and state agencies or local nonprofits or various businesses, anyone that serves people that have disabilities or any kind of access and functional needs. So we try to work on building those relationships in order to work with those organizations or local or state government to try to serve the survivors, the citizens of the state of Louisiana. And we also provide assistance to those organizations and to those branches of government, and try to act as a conduit between the community as well as FEMA federal programming. Next slide, Bambi. So I'm not going to read through all of this, just to give you an overview of probably where we're most heavily ingrained in FEMA. So in terms of individual assistance, one of the main things we try to do is emphasize the importance of question 24 when survivors register for FEMA assistance. And question 24 asks the question of, is anyone in the household elderly or have some type of disability or access and functional need? And so we try to get the word out, whether it's through messaging or however, or we just, reach out to our community partners to make sure that survivors know to answer yes on that question. And once they answer yes to that question, all of those registrants are listed within a database, and that way we'll know how many survivors that we have that may have some type of disability or access and functional needs to help us serve those survivors better. We also do briefings on the process of loss and damages of DME, durable medical equipment. We try to help with that to assist, again, working with our community partners and just making sure FEMA individual assistance understands how to serve survivors. In doing so, we provide materials specific to the disaster for access and functional needs. And one of the biggest things that we have done throughout the course of the multiple concurrent disasters that we have here in the state, we've collaborated quite a bit with the VALs, and that stands for the Voluntary Agency Liaisons. We've collaborated with them quite a bit on making sure that we address any kind of unmet need that survivors may have. And we also assist in setting up an access and functional needs task force within FEMA that we all come together and sit down and discuss all of those cases in which the survivors answered yes to question 24 during the intake process. Next slide, Bambi. All right, so on the opposite end, in terms of public assistance, we advise PA on the PDMGs and other local leaders to assess disaster damages and trends. We also provide them with technical assistance as well, where we look at different areas within the state that have applied for PA to see if there's any kind of access and functional need that needs to be addressed in trying to rebuild or trying to assess the damages that have occurred thus far. And we also do a lot of dissemination of information regarding the affected populations in the declared areas. So our job with PA is more on a broader spectrum, but it's still, we're very heavily involved with them in terms of assisting them, even in terms of when they go in to do the damage assessments as well. Next slide, Bambi. All right, so in external affairs, we collaborate with them to make sure anytime that we have a survivor that needs an interpreter, we work with them to organize and contract out ASLIs, American Sign Language interpreters. So we work to do that. And we also approve any kind of product that's going to be distributed to the public on behalf of FEMA. We work with them to make sure that there's accessible messaging with those products that are delivered as well. And we also provide guidance on any kind of access and functional need that we receive, that EA received, that's a congressional inquiry. So we work quite a bit of those as well to make sure that we address any kind of inquiry that comes from a congressional standpoint. In direct housing, and this has probably been the biggest portion that I've been working with here lately. Once direct housing has been approved according to the disaster, we work really heavily with the direct housing task force on accessibility needs in terms of housing, because we'll have survivors that may need accessibility ramps, or they'll need grab bars in the showers, et cetera. So we work really closely with direct housing to make sure that we address any kind of access and functional need that may occur while they're trying to place survivors in direct housing as well. Next slide, Bambi. All right, so one of the things that I thought may be very helpful during this presentation is to kind of go over some of the myths versus some of the facts in terms of FEMA. We see this and have seen this a lot during the course of the disasters that we've had here since August of 2020. And the first one, and this, again, this list is not all inclusive. It's just some of the ones that we see quite a bit in terms of the myths, in terms of what people think FEMA does versus what FEMA actually does for the public. So we'll go we'll have the myths on the left and you have the facts on the right. The first one, the first myth, I can't get FEMA help since I have insurance. That's the myth. And the fact is, by law, we cannot duplicate benefits, meaning we can't cover the charges if you have homeowners insurance. But what we find is people that are underinsured for their losses should also go ahead and apply to FEMA to see if they qualify for assistance. And of course, that's just going to depend on the situation, but just saying that you don't qualify for FEMA assistance because you have insurance as a blanket statement is a myth. That's not true. You should still go ahead and apply. The second myth, if I get evicted, let me see. If I get evicted from my apartment after disaster, there's nothing FEMA can do to help. That's a myth as well. The fact is, Louisiana renters who face a notice to relocate from their hurricane damaged dwelling may be eligible for disaster assistance from FEMA. So a lot of people think that it's just for homeowners, but they're also for renters as well. So again, you would have to apply. The third one, which goes into the third myth, I'm a renter. I thought FEMA assistance was only for homeowners, for home repairs. Again, FEMA assistance is not just for homeowners. FEMA may provide assistance to help renters who lost personal property or who were displaced. A lot of times with FEMA, just depending on qualifications, you may be eligible to receive rental assistance or also be compensated for loss of property, just depending on your situation and what all is included when you register for FEMA. Next slide, Bambi. righty. Let's see, those are the biggest myths that we see now. And again, this is not all inclusive, but these are some of the major ones that we see quite a bit during disaster. So I guess the main takeaway that I would say is, when in doubt, just apply for FEMA assistance. And the main thing is to make sure that you include any kind of documentation that people ask for. Thank you, baby. I thought I had a few more. And that's the most important thing, is to make sure that when you apply any kind of documentation that they're requesting, make sure that you submit that documentation. Or if you get confused about what you have submitted, what you haven't submitted, what's missing, there's always a FEMA helpline that you can call as well, and they can give you more details on your case and what you're missing and the status of your registration. The fourth myth, I only got about 3 more. The fourth myth, I didn't apply for help because I don't want a loan. This is a big one. A lot of people think that when you apply for FEMA assistance, you're getting a loan. FEMA grants do not have to be paid back. The grants may cover different expenses from temporary housing, home repairs, replacement of personal property, disaster-related needs such as medical, dental, funeral, transportation costs, et cetera, et cetera. The next myth, number 5, if there are other family members or roommates living with me, FEMA is not going to give them any help. That's a myth as well. What FEMA does, they evaluate the needs of all eligible survivors on a case-by-case basis. So you have to be sure to tell FEMA about the needs of all members in your household, whether they're related to one another or not. So if they're living in the household, that needs to be reported once you apply for FEMA assistance. And that's been one of the issues that we face, where everybody that lived in the household was not included when they first applied. So make sure you give all that information once you apply for FEMA assistance. And number 6, the last myth, FEMA has the final word. If my application is denied, that's it. There is nothing I can do about it. Again, this is another myth that is incorrect. Every applicant is entitled to an appeal. So if you are turned down, if you are denied FEMA assistance, there is an appeal process that you can go through. And the best thing to do is just go through that appeal process. No system is perfect. There are some flaws in it. So it's really important that if you are turned down, that you go through the appeal process. At that point, FEMA will work with you to let you know, a lot of times it was just forms were missing, or people didn't submit something they were supposed to submit. So, accidents happen. So I would advise everybody, if you get denied, make sure you go through the appeal process and work with the FEMA helpline to kind of get a clear understanding as to what was missed or why you were denied initially. So that's basically all I have in terms of my presentation for disability integration and how we intersect with MDAC, how we serve the community and we serve the survivors of the state of Louisiana. My contact information is listed here, including my cell phone number and email. Should you have any questions that are related to disability integration, if it's just overall questions within FEMA, I may have the answers, I may not, because I don't claim to be an expert in all FEMA programming, but if I don't have the answer, I can get the answer for you. Thank you so much.
All right, thanks, Crystal. And yes, we do have a wonderful partnership. Louisiana is truly blessed to have you, Crystal, as part of our FEMA team and part of our MDAC team. So what can we do? I mean, what can you do at this point? As far as individual responsibility, plan ahead, prepare a family disaster plan, maintain a disaster supply kit, stock essentials for at least 72 hours. Stay aware, watch and listen to your local news, and listen to your public officials. And again, sometimes public officials are making blanket statements for their general public. But if you know that this emergency and you're electrically dependent, or it's going to take you extra time to get out, plan ahead and put that in your own personal plan. Next slide. Do you have insurance? Review your insurance policies, know your coverage, plan and purchase flood insurance, buy flood insurance even if your home is not in the flood zone. When I moved from New Orleans after Katrina to Baton Rouge, they told me, well, your house is not on the flood zone. I was like, oh no, I have to get flood insurance. So if you live in Louisiana at this point, even if you're not in a flood zone, please consider getting flood insurance. Be sure to consider contents. There's a 30-day wait period for flood insurance to go into effect. So you can start making those preparations now. Next slide. What about the pandemic? So include individual masks for everybody in your family, reinforce social distancing guidelines, protect yourself and others if you're sick, maintain disinfected and good hand hygiene and sanitizers. One of the things we found last year when we put everybody in hotels during the pandemic, because they were in hotels that also had the general public, I would get calls all the time that people were running around with no masks on and not following some of the pandemic considerations. That was for Hurricane Laura. And when we moved into some of our other hurricanes, we went to a congregate setting first. So everyone went to one of those traditional larger shelters. And it was easier at that point to maintain some of the pandemic consideration in that congregate shelter, because we could do mask mandates and everybody in the shelter was there. There was no general public per se in those shelters. It also helped us identify people with access and functional needs and disabilities easier. Finding people with disabilities once they got into hotels was a challenge. So,
fucking crazy whore.
Excuse me? So, I think everybody thought we were over the pandemic. And so our plans for this year is to go to congregate settings first and then move on to non-congregate if the sheltering lasts for a while. We'll just have to see when we go into a disaster where we are in the pandemic. If we are in a major outbreak, those plans might change and we might go to non-congregate first. It is really important for you to, listen to local officials and to pay attention to where we are both in the COVID outbreak and where we are in the evacuation or the sheltering for a particular disaster or event in your jurisdiction. Next slide. This is our keep calm, reach out, and stay well. So we still have a toll-free hotline. It's a helpline, and it provides emotional support, and it links callers to the local governing entities in their area if you need crisis counseling, or if you're struggling with the many disasters or the disaster fatigue, or just in a bad place, in a slump, like, oh my God, this is going to happen again. Reach out, keep calm, and stay well, and reach out to the partners on this through this 1-800-186 helpline. Next slide. We also still have our clearinghouse for COVID-19 tips and resources. It's conquercovid19.louisiana.la. So if you need any additional information about COVID, that's the website that we can direct everyone to so you can get the latest and the greatest on COVID. Next slide. So what can we do to be prepared? And Jessica, I believe this is your slide. So maybe you want to talk a little bit about your experiences and what our population can do to be prepared.
Okay. What can you do to be prepared? Stay calm. Cool heads prevail in times of emergency. We know we all panic, and it's better to stay calm and have a plan ahead of time, which goes on to the next point. Make a plan. Remember, you have to update or change your yearly plans. And I was one of those people that when our support coordinator said, okay, what are your plans? And I said, okay, I'll just jot down something. And I didn't really put a whole lot of thought into it until after the 2016 flood. And then I said, oh no, I really need to put a lot more thought into this. So I encourage you to put a lot of effort into, a lot of thought, a lot of effort into making those plans and having those concrete plans, but know that they may change. If planning gets too overwhelming, start small to keep grounded. Again, I'm one who has high anxiety, so I like to start small. What needs to get done? Start by making a list. If things need to get purchased, we know money is tight with everyone, so make small purchases throughout the year. If you know you're going to need underwear for everyone, buy a pack for each person a month. If you need socks, buy a pack each time. And then have them put away in your bin to say, okay, this is what we're going to do. And remember, Rome wasn't built in a day. Have a family meeting to ensure everyone is aware of the plan. There's always going to be that one person who's out of the loop. So you need to loop everybody in and try to say, okay, this is our plan and this is what we're going to do, because this one person is always going to go astray. In addition to having contacts in your phone, make a hard copy contact list of doctors, mental health professionals, providers, support coordinators, and emergency after hours lines. And I stress the mental health professionals and any emergency after hours lines at this time, just because we know we've all been overwhelmed. And the emergency after hours line, some clinics are closed, some clinics only take these people at this time and these insurances, and some don't take Medicaid. So it's really important to know who will take you, who won't, and stay in touch with your doctors. And as always, your support coordinators, if you have a Medicaid waiver, you should stay in contact with them constantly if you evacuate.
All right, next slide. Oh.
I need to go to the previous one.
Yeah, go back to the previous slide, yes.
I think that one's mine too.
Yes, yes, ma'am, go ahead.
Monitor COVID statistics in nearby states. You want to make sure that some people, same as last year, some states have different mask policies. Some states have different policies on certain things regarding COVID. So you want to make sure to stay abreast of that. Let any providers, including support coordinators, know if you don't plan to stay at home. And this includes your direct support workers, includes any skilled nursing agencies, things like that. Bring extra medical supplies to change out more frequently when evacuating. We know that when we travel, things get lost, things just get misplaced. And sometimes if you're evacuating, you may be in an unfamiliar place and just with illnesses all around, RSV's up, COVID's up, everything. So you may want to change out those supplies more frequently. Be sure to include at least a 5-day supply of medication, medical supplies, masks for an entire family, disinfectant, gloves, etc. And last but not least, bring any necessary comfort items. I think we tend to underestimate this one until we really need it. It includes sensory items, books, headphones, anything that's going to make you or your children more comfortable and make things easier. I'm all about what's going to make it easier for the family.
All right, next slide. So in helping you get together a plan, we have our website at GOSEP. It's www.getagameplan.org. And there's a lot of good resources and tips on how to form a family plan, how to form a business plan, a mitigation plan. And there's also a cool section for kids. So sometimes, you know, we need to make sure that we are keeping our kids in the planning, because they'll get to the shelter, they'll get scared. They have to leave their home, they get scared. And monitor what they understand too. So you could go to getagameplan.org and try to bite the little elephant, like Jessica said. Rome wasn't built in a day. So you can go here and figure out what step 1 is for you and your family. Next slide. So we also have our Louisiana Emergency Preparedness Guides. These preparedness guides are on the GoStep website. You can also go to some of your support coordinators could have these resource guides. Some of the support agencies, the local Red Cross that have some of these emergency preparedness guides. They are written in English, Vietnamese, and in Spanish. So you can find the PDF files on our website. It has a lot of good information on evacuations. It has a list of all of the Office of Emergency Preparedness directors in our state and their phone numbers. You can also get information from our State Joint Information Center. It's called the JIC, and our press staff will put out information to local media and do different press releases during an emergency. We also have the Louisiana EAS system that we can, as a state, override, or we can, get onto your news and or override your TV programs and give out various alerts. Then there's the NOAA weather radio, and we don't put out the ESA weather alerts. Those come straight from the National Weather Service, but all of the other alerts we can control. Some of the ones we put out as a GoStep or as a state are like when we shut down I-10 or major things we would put out as a state. But more than likely, some of these alerts and the EAS systems will come from your local Office of Emergency Preparedness. Next slide. We also put out certain public information, PSAs, public service announcements. We have them on the news, the television, the radio, and we do them with a bunch of different local celebrities, some of our state leadership. I know during COVID, we did one with Coach O. Several people in Louisiana, happen to want to get the message from the LSU football coach. So we do have a lot of public information and public service announcements. Next slide. Get a Game Plan also has an app for your phone. So you can download it from the Apple Store, from your Android shop. And it's just a mobile version of Get a Game Plan. And there's some interesting different things. You can upload pictures. You can say that you're safe. And you can develop your emergency game plan. Saying that and checking in that you're safe is important, because a lot of times we'll have the support coordinators that will call GoStep or call the agency in charge of the shelter and want to know where their people are. Well, sometimes it's hard for us running shelters to know if someone's looking for you for a nefarious reason, or they're actually looking for you and you actually want them to know where you are. So this on our website, you can mark yourself safe. And there's also one in Red Cross called Safe and Well that you can use to mark yourself safe in an emergency. So this is a handy app. If you have space and a device, please download this to your phone. Next slide. So this website, emergency.la.gov, the other resources I talked about for public information are up all year long, like 24/7. You can go to Get a Game Plan. You can look at our PSAs. This website, emergency.la.gov, is going to be tailored specifically for an event. So this page will only be live if there's a emergency live in Louisiana. And as you can see, there's links over to the right with different agencies, links to DOTD. There's all kind of information. So this would be your one-stop shop for if you want to know what the weather's doing, if you want to know what the businesses are doing. So this, again, is only activated in an emergency, but it'll be a good one-stop shop for everybody to click on and figure out where we are and to create one really good operating picture for the state of Louisiana. Next slide. This is another alert system that we have in Louisiana called AlertFM. You can download this app from the App Store again, and you can sign up for different alerts on your phone. A lot of the alerts are weather related. Back when it first started, there was a digital transmission that you went to a receiver, but we really don't use those anymore. It transmits digital messages based on your geographics or your organizational groupings. There's no fees. The customers can download it. I would encourage you to download this. It will send, each parish has the ability to send out alerts through AlertFM as we do with the state. So download this app and it will give you weather emergencies. It will give you Amber alerts. It'll give you hazardous material, hazmat incidents in Louisiana. So just, this is another tool that we have as emergency managers in our toolbox to communicate disasters to our public. Next slide. GOSEP also has social media pages. During an emergency, we get many, many hits on our Facebook page, our Twitter page. I know nobody have Facebook and Twitter. I'm not sure about Instagram, but this is a copy of our Facebook page. I think, Bambi, the next slide is going to be our Twitter. So there will be links on there, links to maps, links to weather reports. So if you need information during a disaster, you can check out our social media pages. Next slide. Our communications director, that's him, his picture right there, that's Mike Steele. And he does, I think, a monthly podcast. So he'll invite a representative from FEMA maybe one day to talk about a certain FEMA topic, or he'll invite the Coastal Protection Agency to talk about coastal projects. I would encourage you guys, if there's a topic you think you want to listen to or hear something on an expert, go and look at the podcast. Again, they're all at our gosep.la.gov/resources/podcast. And you can look at the archive podcast that Mike Steele has, and maybe you find a topic that you would really be interested in. Next slide. We're also on the web at gosep.la.gov. And you can also go to, like I said before, getagameplan.org. GOSEP.la.gov will have all of the preparedness guides and will be a wealth of information for the information from our state and our state agencies. Next slide. And I do believe that is it. And I have enjoyed speaking with you guys today. I hope you learned a lot. I'm usually the low man on the totem pole. The other experts that you heard from are really experts. And if we haven't portrayed anything else, we do. It is our life mission, all of the panelists here, to make sure that in an emergency, everyone is remembering our whole community. And that includes people with disabilities, people with access and functional needs, and our aging population. And Bambi, unless anybody else on the panel has everything else, I think that's it for us.
Thank you, everyone. Jessica, Amy, Cheri, Crystal, for all the information. We had a great second day of the conference. We had our halfway point. Our conference will start off again tomorrow morning at 9 o'clock, and we have 5 great sessions again tomorrow. All of our sessions are being published on the Governor's Office of Community Programs YouTube channel. So we'll have public access if you want to go back and watch anything or share with anyone. And I'll go ahead and close for today, and we'll see you all tomorrow. Thank you, guys.